All right, happy Friday and welcome to Sick Call. Thank you for joining us for our special panel discussion on anesthesia nursing. To all of you that registered, we are so glad you were able to join us, and we will announce the winner of our grab bag at the end of our show. So stay tuned. As Army medicine recruiters, the mission for nurse anesthetists is a big one for us. This profession is a very important one, and we hope to answer many of your questions here today about what the career entails and how you too can join our team. With me today, we have a panel of CRNAs that are at different levels of experience in Army medicine. Amongst our guests this morning, we are welcoming Colonel Wesley Anderson, Commander of the 32nd Medical Brigade.
Morning.
Lieutenant Colonel Young Yeager, Assistant Professor at U.S. Army Graduate Program in Anesthesia Nursing.
Morning.
Major Jessica Stone, Clinical Assistant Professor, U.S. Army Graduate Program in Anesthesia Nursing.
Good morning, everyone.
Major David Robinson, Lead Clinical Instructor, Phase 2, Brooke Army Medical Center.
Good morning.
Major Xavier Green, CRNA, Brooke Army Medical Center. We hope to get him back on. And lastly, Captain Connor McClellan, CRNA, Brooke Army Medical Center.
Good morning.
So good morning, and thank you everyone for joining us. Colonel Anderson, would you like to open the discussion this morning by opening the floor to you? How did you get started in Army nursing?
So I got started in Army nursing as an enlisted medic back in '88, and they sent me on a 4-year ROTC scholarship back to nursing school at Creighton. Then I did my first assignment at Fitzsimmons Army Medical Center in Aurora, and then to San Antonio, where I worked burn ICU, surgical ICU, and med-surg ICU.
Wow, what a journey. And so direct commissioning, are there any other direct commissioning officers on the panel?
Yeah.
All right, about 50%. Awesome. So Colonel Yeager and Major Stone are here this morning to represent the U.S. Army Graduate Program in Anesthesia Nursing, and it's most commonly referred as USAGPAN. So, sir, would you like to say a few words about the program, which is rated 7 in Nation, U.S. News and World Report?
Well, thank you for that introduction. Yes, USAGPAN is definitely one of the best programs in the nation. We produce CRNAs that are required to go out and take care of very important individuals, wounded warriors out on the battlefield. So it's a very noble profession that we're among other CRNAs. And what I find is that this particular program prepares you to go out to combat settings and also to perform anesthesia here on the stateside. And all of our graduates go on to very successful careers. And they are amazing individuals that are contributing to our community in the civilian realm after they leave the military. So it's an excellent program that prepares you for your military experience, and it will also prepare you for your anesthesia practice as you leave.
Cool.
Now, Captain McClellan, would you like to tell us about your experience in the program?
Yeah, absolutely. So I was a direct commission, as I mentioned earlier. I was a civilian ICU nurse, and probably like a lot of you listening, didn't realize that direct commissioning in the program was something that was available to a civilian ICU nurse. But after talking with a AMED recruiter, discovered that it was, and went through that process of commissioning at Fort Sam Houston to do my initial officer training and started the program here at Fort Sam Houston. I think what drew me to the program was just, I think at the time it was the #1 or #2 ranked program in the country. It also had a reputation for producing autonomous independent CRNAs. And then I know the program itself also focused a lot on regional anesthesia, which I know some civilian programs really hadn't made that big transition to yet. And the program is also known for its extensive research, both in terms of the DMP capstone project, but also animal research that we do at phase 1. So all that was very interesting to me. It drew me in, as well as the opportunity to attend a top-notch program paid for and receive some officer pay for me and my family while I was in the program. First year of the program, I think a lot of my classmates were kind of blown away just by the resources that were available to us here at Phase 1. I know a bunch of my former civilian ICU coworkers that went through civilian programs. Just in talking with them, what their experiences were, the resources that we had available to us at USAGPAN were just far and away more than what they had. Whenever I got to Phase 1, it was something like 10 or 11 PhDs or DNPs that were core faculty. For a class of 23 to 25 students, that's just an incredible student-faculty ratio. And so having those resources available to you while you're in this strenuous program just really sets you up for clinical success in the last 2 years of the program. Another thing that I think sets USAGPAN apart is the dedicated core faculty you have during the last 2 years of your program, whenever you're off to your clinical training. And not only do you have core faculty there that are they're teaching you, guiding you as you develop practice. You also have the anesthesia departments at your Army hospitals that you're training at. They have it built into their daily schedule, time set aside, morning report or other lectures or professional opportunities that are dedicated to the students, to the CRNA students there. So I think everything in the day is just kind of geared around the trainees while they're in the program. And while that is extremely intimidating at times, there was never a point during my 3 years of training where I felt like I wasn't getting the best training available to me in the country, and I knew that I was going to be prepared for the moment I graduated to do what we need to do in our downrange mission, as well as being a stateside anesthesia provider. So, great program. I'd do it all over again in a heartbeat.
All right. Yeah, sure. What other deployment experience have any other the board panel had been part of that they can share, maybe even humanitarian missions?
I've deployed to the Middle East, and I also deployed to Honduras for a humanitarian medical training exercise for a couple of weeks.
Wow.
And I participated in what we call med readies. They're medical missions that are intended to improve the relationship of the United States with the indigenous population of those particular countries. My specific med ready actually went down to the Dominican Republic, and it was actually a really rewarding experience where we did cleft palate repair, cleft lip repair, and also Le Forts for individuals who had never had medical care in their entire lives. And it was a fantastic experience working with the military individuals that were down there, and also with the civilian physicians who were helping us on that mission. In the end, we ended up treating over 50 individuals who were struggling with these particular deformities for a long period of time. I think the oldest individual that we treated was in their early 20s, and it was a life-changing event. If you can imagine having a cleft lip and cleft palate going out throughout your entire life. And the U.S. Army came in and we administered the care to repair it.
Wow. Thank you, sir.
Major Stone, what drew you to your decision to become an Army CRNA?
Ma'am, I think you're muted.
Apologies, there was some background noise. So what drew me to select a career as an Army CRNA? I was fortunate in my high school years to have some influence from some retired military officers, and then during my college ROTC career at the University of Texas to interact with prior service nurses who had either come back as enlisted to become officers, and they had talked to me about becoming an Army CRNA. And I also had a professor, to include General Bester, who was a chief of our nurse corps, who taught at University of Texas. So interacting with those individuals and talking about the career opportunities in the Army and becoming an advanced practice nurse were something I had exposure to very early on in my nursing career. And I was also a very motivated individual and enjoy having some autonomy me in my work. And so through those experiences, talking with them and going through the University of Texas program with the prior officers I had, they are retired. They had a big influence on me to select this career. And then while in the Army, the fact that they will pay for me to go back to school, and it is one of the highest ranked programs and is well known all over the U.S. and our graduates and our providers are highly sought after, was a big motivating factor for me to also pursue this job. And then just knowing the caliber of individuals I did interact with who were CRNAs, and through my critical care career, my deployments, they were pretty impressive and incredible individuals that also motivated me to want to be able to function and perform and practice at that level. And so that's why I wanted to be an Army CRNA. And then you get to work with amazing patient population in the military, not just stateside, but also in your deployments as well. And so those things are pretty incredible experiences to have. And so those are also part of my motivation.
Oh, thank you, ma'am. So, Major Green, can you tell us what is your most favorite thing about being an Army Nurse Corps officer? Oh, did we just?
We just lost him again.
Lost him again.
So instead, Major Robinson, how has your career benefited from Army nursing?
Yeah, I would say my career has benefited just in the training that we receive. You know, like Captain McClellan said, the training we receive here really just top notch, and the resources available to us. But also the fact that you get to do things that your civilian counterparts are probably never doing, the things like med rets that Colonel Yeager talked about, the deployments, whether that be to the Middle East or to New York City or just other areas of the country for disaster relief. A lot of the things that we do in military medicine are pretty much unheard of in civilian world. And so I think that's been a big benefit to myself as well as probably everybody else.
Yeah.
Yeah. Didn't somebody just come back from New York, or was that Major Green?
That's Major Green.
Say that again, sir.
Oh, I was just asking. I know somebody just came back from New York. I wasn't sure if it was Major Green or not, but he's having technical difficulties, so.
Yeah, I can speak kind of what his experience. Well, I think Major Robinson, you were there as well, weren't you?
Yeah, we both were. Yeah, we were there for about 7 or 8 weeks up in New York, right kind of at the height of the pandemic, to provide up there.
What was that experience like, sir? Can you kind of explain it a little bit more? Because we have a population of folks that aren't currently serving or are not current CRNAs. So what does it mean to go support the COVID mission as a CRNA?
So for us, what it meant was we kind of got a short notice to pack our bags and leave for New York City in about 3 days. And then we flew to New York, and this was during the early days when before the Javits Center was set up and ready to take patients. And so our job was to help establish that, to get it set up, ready to receive patients. And then we wound up treating about 1,100 patients, and a wide variety of people, were anywhere from mildly sick, people that were intubated and on a ventilator. And it was our job as CRNAs to provide expertise in respiratory care, as well as intubating, putting in central lines, managing vasoactive medications, and as well as had several missions where we had to go get on an ambulance, go to some of the other hospitals in the city and take their patients who were intubated, ventilated, bring them to the Javits Center or to the U.S. Navy ship there, the Comfort, to provide care for them. So overall, it was very interesting and very.
Now, what other deployment experiences have any of you been a part of that you would like to share?
I'll go ahead and take this one to start with. So I have had 3 deployments throughout my nursing career. The first 2 were as a critical care nurse, and the most recent in 2018 as a CRNA. I've deployed with 2 combat support hospitals, which now are field hospitals, but split-based operations to Iraq and Afghanistan. During my Iraq deployment, I was working in a detainee facility, so I did care for local military, our active duty reservists, our local civilians, to include, yes, employees who may have been there, contractors, third country nationals, as well as the detainee population. It was a very interesting deployment, and you're basically working in a prison setting. So that was an experience that not a lot of people have had, and that was a very high profile mission as well. So it was a very, very cool experience to have, and I learned a lot. My second was to Afghanistan, again with a split combat support hospital, and we cared again for anyone in the area. And again, your medical rules of engagement are different everywhere you go. So here we did have the opportunity to care for military working dogs, civilians, children. We ran a clinic for the local population, and we cared for our active duty military as well as other civilian and contractors. And then I most recently deployed to Syria, which was probably the deployment I saw the most patients. We saw a lot, and it was with a forward resuscitative surgical team. So we were in a small building, a school. We moved between locations, and we were a much smaller team. We saw very severe trauma injuries, and we did take care of several military working dogs, active military, DOD contractors, as well as a lot of civilians, most civilians who were being injured in their local towns. These are all very humbling experiences, and your interaction with those individuals in those countries and learning their culture and about them and who they are, and your opportunity to show them who Americans are and what we do and what our military does and how we do care about people, and we do more than just shoot guns and blow things up. We are a military that does a lot more than that. And so having those opportunities has been really amazing. And the Syrian deployment was actually my most memorable, and I wouldn't change any of it for the world. And that's also part of the reason I joined the Army, to go and do those missions that otherwise you would not have an opportunity to do, and save people's lives and be there for them on the worst day of their life. You're there to help them out.
Ooh, train to save. There we go. Anyone else want to share any other deployment experience? I thought it was very, very moving. Anyone else?
Yeah, I mean, I think we have a variety, just the same thing as Major Robinson was talking about. I know Captain Green's not on, but Captain Quillen's been downrange as well. But, the skill sets that we learn downrange, we use downrange, very applicable in the civilian world, serving them. I mean, I've been to Bosnia, Kosovo, Afghanistan, Iraq, for standard combat type deployments, but also the Republic of Georgia, Estonia, Lithuania, helping them get ready for their NATO entrance into NATO. So I think the variety that not just with the military, but in the career field of military medicine as well, there's a lot of opportunities. You're never going to get bored. There's always something to do, and stretch yourself, and not just win the nation's war, which is what the military does, but also the service we provide to our country and our brothers and sisters around the world.
Well, thank you, sir. And so, Colonel Anderson, I know you're currently in command. Can you talk about the leadership opportunities as an officer?
Well, there's several. Again, that's when we get to the point of talking about diversity. In the civilian world, you really, as an anesthesia provider, probably as a chief CRNA, would be about as far as you're ever going to go in leadership or stretching yourself and your abilities. Within the military, like I said, there's a lot of different opportunities. One of those is command. I've commanded twice at the company level, once at the battalion level, currently in command of a brigade, which provides the enlisted and officer training for all the medical personnel in the U.S. And a couple of other spots. So currently I have around 6,500 soldiers, 5 battalions that I'm responsible for every day to make sure they get the resources so they can continue training. So that's just an opportunity that you would never see a CRNA in the civilian world. The to be given those opportunities to stretch themselves, but really to take care of their brothers and sisters and provide that initial training that they will use, whether it's a combat medic or a CRNA, that they will use downrange to save lives.
Listen.
Lieutenant Colonel Yeager, you recently shared with us that you are very much involved in research and development within your field. Would you expound for our viewers what research opportunities you've been a part of?
Sure. So my career track has been very different than Colonel Anderson's, which represents the disparate choices you can make within the military and the opportunities that exist within the military. My choice was to go through nurse anesthesia school, and then I was identified as an individual that would be an applicant for a neuroscience PhD. Once I became a neuroscience PhD, then I started doing a lot of research, and this is going to be a lot of bench science research. I've done research in traumatic brain injury, looking at the impact of iron in the acute phase after injury in the brain, and its effect on oxidative stress, which is really exciting work. In addition to that, there is a large organization named the Tri-Service Nursing Research Program, which is a dedicated research organization that funds nursing-initiated research. So through that organization, we've been able to be funded substantially, actually, with grants up to $1 million in order to conduct resuscitative medicine research. We do a lot of research looking at the pharmacokinetics of epinephrine after administration, and trying to find out what's the best route, the combination in order to induce return to spontaneous circulation. In addition to that, there are other opportunities that we can do. There's plenty of very traditional nursing type research that we do concerning surveys, looking at herbal medications and its use among patients, and also its use among CRNAs and also other nursing professionals. And then there is more military specific research that's out, which is really exciting. And we're looking specifically at the reuse of single-use medical supplies at this point in time. I know that sounds kind of foreign to most individuals, but you got to remember, from a military perspective, we are instructed to prepare for something called prolonged field care. And through that, there may be a possibility where we won't get resupply, or a possibility where we will have mass casualty situations where we may need to run through supplies very quickly. Therefore, we need to have a backup plan, like all anesthesia providers always have. We always have a backup plan in order to ensure we can administer care to the best of our abilities in those combat settings. So currently right now, we're looking at the effects of disinfecting agents on endotracheal tubes, and to see if they can appropriately disinfect them, and if those disinfecting agents causes any detrimental effect to the PVC plastic that comprises of the endotracheal tube. So that's exciting stuff. On the horizon for us here at USAGPAN, we're potentially going to be looking at the efficacy of medications after a serial freeze-thaw cycle. So this is an anticipation in cold weather combat operations, where we may have some of our medications freeze and thaw repeatedly in those environments. Imagine Bastogne, and trying to administer care and trying to determine if there's any change in efficacy of some of those drugs that we use in anesthesia. So that's really exciting work that we're going to be focused on here shortly. In addition to that, we're going to be taking a look at the efficacy of utilization of mannequins, perfused cadavers, and also live tissue training, to see what the outcomes are in terms of the training value that we can give to individuals, and whether individuals train better in those with those particular models. So there's a lot of research that goes on within our community, and it's been thrilling to be a part of it, and to also shape policy. I can honestly say that as a civilian, I probably wouldn't have had these same opportunities that the Army has provided me in terms of my research abilities. And being only 4 years outside of my PhD at this point, it's pretty extraordinary how far I've come in this short amount of time.
Yeah, I mean, I think that's one of the advantages of the program that Colonel Yeager is talking about. We obviously graduate DMPs as a base level. We've been doing that for several years, probably one of the earliest programs to adapt to go to the DMP program. But the number of PhDs that we have on staff teaching students. You know, it's although they're getting their DMPs, they're also with capstone projects, they're also getting the opportunity, as Captain Yeager was talking about, to really do bench research, and that's been one of the things that USAGPAN has always done. And that funding stream coming from the military and that ability to really reach out is really one of the differences. I don't think you'll see anywhere else in the country that the level of research that they do. And again, a lot of the medical adaptations that the civilian world uses, especially in trauma, came from the military, and it continues to come from the military. So I think that's one of the huge advantages, PhDs like Captain Stone and Colonel Yeager, and really the ability for anyone that after they graduate the program with their DMP, if they want to go on and get a PhD in pharmacokinetics, education, neuroscience, those abilities are there. But I really think that's a tremendous aspect of the program.
Thank you, sir. So we've talked about mobilizations, we've talked about deployments, humanitarian missions. We've also talked about leadership opportunities, research and development. Let's talk about clinicals. So this question is for Major Robinson. What can our viewers expect from the clinical rotations?
Yes, ma'am. The viewers can expect that before they get here to what we call phase 2 or the clinical rotation, they'll spend their first year at Fort Sam Houston doing a lot of classroom and didactic work and just learning about the pharmacology and physiology of anesthesia. And then when they get to their clinical site, they can expect that that's the point where they will learn how to put all of that knowledge into practice in the clinical setting, taking care of patients. They will take care of patients kind of across the lifespan. So anything from pediatrics to geriatrics to obstetrics. They will also do a wide variety of anesthetic techniques. So everything from learning how to do a general anesthetic to how to place a spinal or an epidural, regional blocks for patients, sedation, all of those types of things they will learn how to do here. And as part of that, they expect they will have some out rotations to other hospitals throughout the country to support their learning for specific patient populations. So they might have a out rotation to a children's hospital to learn pediatric anesthesia, or to another facility to go learn obstetric anesthesia, or to do a neuro rotation. So they might go for 4 to 6 weeks out to some other place to specifically learn about those things. But at the end of their 2 years here in the clinical rotation, which is the end of their 3 years total, we expect them to be able to go out and practice independently.
Cool. Thank you.
Major Stone.
Oops. Oh,
I was going to say, Colonel Captain McClellan is probably the freshest out of school, kind of his perspective on that. But again, I think what Major Robinson is talking about, we go across the country for those clinicals. Normally in an anesthesia program, one, they're not required to get to the level of autonomy that we do practice at. To get to that level of autonomy, though, we go all over the country. We're not limited to a local area. We may go down to Miami, we may go to St. Louis, wherever the best cases in the country are to improve our skills. That's where we're going to go and do that training to ensure that we can practice independently, because we do. When we're downrange on an FRST, a GHOST team, there may only be 6 medical people setting up an OR suite out of a dune buggy. There's no phone a friend. You either execute and save their lives, or one of your brothers and sisters dies. But it'd be kind of interesting for Captain McClellan to talk about his experience and what he thought going through the program.
Yeah, so all the out rotations are going to kind of depend on what your local military treatment facility has to offer. So like for students that are at BMC, if anyone's not familiar with Brooke Army Medical Center, it's the DoD's only level 1 trauma center. So they have a wider variety of cases and a more acute patient population than many of our military hospitals. So they're sorry, I think I'm having mic issues. Can you guys hear me okay? anyways, they're what supplemental out rotations they get may be different than what I got training at Eisenhower Army Medical Center down at Fort Gordon, Georgia. But I will say, every CRNA that graduates in the country has different subspecialties and procedures and minimum numbers with which they're required to obtain to graduate with. Sorry, can you hear me okay?
Okay.
Sorry,
Quiet.
sir. It's very quiet, and we know you've got some valuable information to share. We want to hear you.
Let me see if I can turn my mic up a little bit.
We might just have to yell.
The Army voice.
Is that any better?
That's better, sir.
Okay, all right, I'll shout. But anyways, we more than enough covered all of the minimum numbers that we needed for all the different subspecialties. And one of the really great things about the program, I think, especially in contrast with some of the civilian programs that many of my former ICU friends went through, was that if there's an out rotation, say it's a trauma rotation that they set up a hospital, that no longer is a valuable, value-added rotation, be it for maybe the environments, not especially pro CRNA, maybe the case volume isn't enough that it's worth our time. The core faculty at all the different phase 2 sites regularly goes out to assess the clinical sites and the value that they bring to the program. And our core faculty also listens to our feedback. We're expected to kind of give a debriefing when we return from a rotation, let everyone know how it was. And if they deem a particular site as not being value added to our education, they won't sit there anymore and they'll find somewhere else. From my experience, the rotations that we go to, the anesthesia providers at all of those locations really enjoy having Army SRNAs there. I think most of them, like I had the opportunity to be the first student to go to a new site to our outpatient, and it's their first time getting Army SRNAs. The faculty were kind of blown away with by where we were at, the benefits they could give us as students, as trainees, while we were there. And so they really enjoyed having us there. And something that's already good education at our home station. So it's always changing. The good things about the program, and I'm always trying to improve it. So I would say that more education receive at our kind of phase 2 site is great, but the supplemental experience that you get at the civilian rotations is also amazing. So all in all, it's pretty great.
Yeah, I would just add a couple of things to what Captain McClellan said. He mentioned it, and it's true that we are very feedback driven with the program. So every time a student comes back from an out rotation, we ask them to fill out a survey of that site. Every term, the students put in feedback for all of their instructors. And so we take that feedback very seriously, and we make a lot of changes to the program based on student feedback. And so I think that's one of the things that keeps us consistently, as the top-rated program in the country. The other thing that he mentioned is the out rotations themselves. One of the rotations our students here do is to Texas Children's for their pediatric rotation. And, that's a world-class facility for pediatric medicine. Some of the anesthesia providers there are writing, chapters in anesthesia textbooks on pediatric anesthesia. So these are the kind of places that we're getting our students. And so it really does lead to a top-notch.
One other thing that I want to add to this conversation concerning clinical practice is that USAGPAN offers the opportunity for you to learn all facets of anesthesia care. The expectation is that you are going to leave this program and be fully functional in all the environments that the Army needs you to function in. So there is every opportunity is pushed forward to teach all those skill sets that Major Robinson had discussed earlier. And that's important, right? It's an important distinction between the USAGPAN program versus a lot of the civilian programs that are limited on state practice guidelines and also individual localities in terms of their policies that govern CRNA practice. So in the military, we are steadfast in the education of our nurse anesthetists to be able to perform, to take care of, again, the most important patient that you could take care of, which is a wounded warrior. So that's an important distinction that I wanted to point out.
Yeah, I think one of the other things that Captain McClellan brought up that's interesting, it's not, going to some of those sites all across the country, some of the top sites, and Major Robinson for that matter, some of the top sites, it's not, we bring back a lot. That interaction that we get working with some of the top writers, the people in the forefront of the practice, we bring that back and re-energize that into the military and that system as well. So I think that's that ability, and then used by Major Robinson and Major Green when they went to New York and the other places we go. It's a pretty seamless fit. We fit in very quickly. It does not take us long to figure out what's going on and to be able to support those other missions and then bring those strengths back to the military. I think it's a tremendous benefit to both organizations.
And that leads back into, sir, the importance or how sought after military nurse anesthetists are once we finally leave. I think Major Stone had made a mention of this earlier as well. It's because those skill sets that we're taught in the military, we are very marketable once you finally leave military service, and every anesthesia program in the nation is interested in procuring military CRNAs because we're trained to perform in every setting.
Yeah, that's true. As I'm coming up on the end of my career. In 2 years, I'll hit 35, and I'll either up or out. You get promoted or you leave. But I literally probably get 3 to 4 calls a week from recruiters around the country to come and work in their institutions. And it's not because I'm some super Army CRNA. It's just that I'm an Army CRNA.
And I'll say,
Army.
I'll say on that note as well. Can you hear me better? I got microphone. You good?
Much better,
All right.
sir. Thank you.
On that note as well, networking in the Army provides for a lot of opportunities as well. And I know everyone here today probably knows, half a dozen or more folks that have retired or ETS'd out of the military and are working at places, or maybe they've set up their own practices, and they will look to hire potentially only former military CRNAs because they know the level of the training and experience that they're coming equipped with. So even if you don't do 35 years like Colonel Anderson's going to do, the opportunities after your military life will abound.
There's another point that I'd like to make is I am biased because I am a professor at USAGPAN along with Major Stone. However, if you are trained in a civilian program and enter into the military, you will receive the necessary training to bring you up on par with your peers. So just because you attended USAGPAN doesn't make you the only way of becoming a nurse anesthetist. We get nurse anesthetists from all different areas in order to fill our needs in the military. But you'll get the appropriate training, and so you'll be able to deploy like the rest of us.
Major Stone, we're highlighting the USAGPAN program this morning because the application window is open now. What do our viewers need to be qualified for admission?
All right, great question. So to be qualified for admission, there are about 13 things that I'm going to mention here. The first one is the application process itself, and applicants will need to submit applications to the Baylor School of Nursing. There will also be applications to the funding or board process entity, and for USAREC for your direct commissions, that will be their route, and it will be long-term health education for your already on active duty personnel. You must have a Bachelor's of Science in Nursing or Master's of Science in Nursing and have all of the transcripts available for that, with a minimum of a 3.0 GPA. that is on a 4-point scale. That does include your hard science courses, such as your biochemistries, organic chemistries, biology, anatomy, and physiology. We will calculate that science GPA out separately, so people can do that on their own to see if they meet that criteria or not. But we can help you out with that here at USAGPAN. Applicants must also have a biochemistry or organic chemistry course within the last 5 years of the time they're applying. They must also have an undergraduate or graduate level statistics course somewhere in their transcript. To be competitive for GRE scores, we're looking at least a combined 300. That's with the quantitative and verbal scores combined. That's not a hard 300, but the goal is 300 with a minimum score of 3.5 in the writing. Applicants must also have at least 12 months of critical care nursing experience as defined by the Council on Accreditation of Nursing Anesthesia Educational Programs. And that does include ICU intensive care unit work as well as appropriate emergency nursing care. So if that individual is able to prove they have ER experience that's equitable in acuity to the ICU environment, and that's something that would also qualify the individual. Individuals are going to need letters of recommendation. There will be 3 of them. So those will also be part of the application process. Applicants will also need to be at least age 42 or no more than age 42 by the time they're commissioning, and that is in order to allow for a 20-year active duty stint of possible time, so that before you reach that age 62 kind of mandatory retirement time. So age 42 before commissioning, a current unrestricted registered nursing license, and applicants who are coming in also need to meet the Army height and weight standards, as well as be able to pass a physical fitness test, and that's our current Army combat fitness test. And so those are all of your requirements for application and eligibility information. And so that's what you need to become a USAGPAN applicant and get admission into the program.
Good. Thank you, Major Stone. So Colonel Yeager, based on what Major Stone highlighted, we know what it takes to be a competitive applicant. However, can you, sir, tell us what prospective applicants need to know about being successful in your program?
So what it really comes down to, at least in my opinion, is attitude. These individuals who are motivated, individuals who are disciplined, and individuals who are willing to learn at a higher level and have that dedication. That's what's going to make you successful in USAGPAN. You can make a reasonable argument that that'll make you successful anywhere you go. But more so here at USAGPAN, there's a lot of expectations on the individuals that are coming through our program. Part of that is because you're being paid as an Army officer and you're expected to serve as an Army officer. So there's a lot of additional requirements that's placed on individuals as Army officers. So it is an attitude that you come in and you're ready and you're willing to serve, and that'll make a big difference. Now, where that could make you even more competitive in the application process, it really comes back down to that interview, right? So everyone could look awesome on paper. You know, you have these amazing individuals that look stellar on paper, but really that interview is where you could show on how you shine, and you could demonstrate that attitude that I'm discussing right now, and be sure to impress that individual who is likely to be a site director of one of the 7 USAGPAN sites, and be sure to convey to that individual how much you want to serve in the U.S. military and how much you want to be a CRNA and take care of the best patient population in the world. So I think that really plays a big role. In addition to that, I do believe that critical thinking skills really makes the transition from a nurse to a nurse anesthesia provider. So that's an important distinction. So you have to be able to work through that critical thinking piece, and that's what ties that into the ICU care. Those individuals who have been in the ICU for an extended period of time have demonstrated that they have critical thinking skills that are necessary in order to become an anesthetist. So make sure that you're willing to accept those things and to move forward and learn as much as you can. And I think that will give you success in our program.
If I may
Yes,
add
sir.
one thing, Colonel Yeager, I apologize. You did mention the shadowing and interview process, which I did not mention. That is part of your application process. So prospective students will need to go and do an interview with one of our phase 2 sites throughout the U.S. and meet with the program directors. And that is also one of the letters of recommendation that they'll be but you will have to do that process as well. Thank you for
And
mentioning that, Colonel Yeager.
And that's an opportunity both ways, right? An opportunity, as Colonel Yeager and Major Stone have talked about, for us to look at the applicant and to see if we think they're a good fit. But it's also a good opportunity for the applicant, reviewers, to see if the Army's a good fit. You can spend 2-3 days. It's normally a day, but you can spend up to 2-3 days really working with other SRNAs, working with anesthesia providers, asking questions, the phase 2 directors, and really getting an idea of what the Army's about, the autonomy, the program itself. So it's not just us interviewing you, it's also you getting a chance to learn more about us.
Good point, sir. Thank you.
Now, Captain McClendon, as a recent graduate of the USAGPAN program, can you elaborate on the incentives of taking advantage of this program? Was it what you expected, more or less?
On a very practical level, financial incentives were something that were of great interest to me when I was considering the program. I think on a very superficial level, obviously, I think the call to serve and to be a part of the military is a huge part of it, and to kind of frame everyone's interest in the program. But on a very practical level, the idea of getting a top-notch education, not only for free, but to receive a full officer's salary, really kind of alleviates some of the financial burden that prospective CRNA students undertake when thinking about doing a program. We have people coming in and starting the program at various stages of life. We have 23, 24, 25-year-olds that are young single soldiers. And we have individuals well into kind of their family life with multiple kids, school-age kids, and some of the things that they have to deal with that, some of the considerations that come with that. So the idea of receiving a full officer's salary while you're in school was really attractive to me. And just to lay it out there, I know we had talked about it earlier in the week. I just looked at numbers real quick just to give anyone listening an idea, because it's about as clear as mud when you try to do a quick Google search and figure out how much you'll be making while you're in the program. But it ends up amounting to a little over $6,000 a month when you're starting the program, assuming you come in as a first lieutenant, which most students do. Some come in as a second lieutenant. It ends up being about $6,000 a month. Keep in mind a significant portion of that, our housing allowance and our allowance for sustenance, are tax-free. So the pay that you'll receive, the compensation you'll receive as an Army officer while you're in school, is, I believe it's competitive with most RN salaries. For me, I was making more as a CRNA student, as a trainee, than I was as a civilian ICU nurse, working overnight with my CCRN, kind of maxed out on all the extra pays I could do. So alleviated a lot of that financial stress for me and my family when I was starting the program, because the program's tough enough as it is, and the Army understands that. And although you do have some, the normal obligations that active duty Army officers have, the idea of you and your family being taken care of while you can focus on your training and studies was, I feel like it was a tremendous advantage of doing USAGPAN.
I would also add that you still have opportunities as a second lieutenant and first lieutenant. Based on your time, you are still going to promote while you're in school, and that will be an additional pay increase. And as you still accrue time, some of our SRNAs, depending on where they are at that experience when they come into the military, with what rank they get, may promote also in school or as they're getting out of school. So you will still continue to receive promotions while you are an SRNA and get those pay raises that go along with that.
Yeah, absolutely. I actually paid off my civilian nursing school loans while I was in CRNA school, which I feel like that's an interesting contrast to what a lot of my civilian CRNA counterparts had to experience.
And I think the advantage that, in addition to the pay and the medical care where you're not paying the insurance, et cetera. But you're not paying tuition either, right? And I think the advantage of that is it allows our students to focus, where you're not worried about their electric bill or student loans you've already accrued, et cetera. So I think not only are you not spending $150,000 to go to anesthesia school, you're making 65, 75 a year with a chance to promote while you're in anesthesia school, but you can focus. And I think that's one of the advantages of our program, that it allows our students to focus on their training and knowing that their families are taken care of.
So speaking of the training, sir, can you elaborate more on the advanced education training for CRNAs as a whole collectively?
Sure. So again, we talked about this earlier, that the USAGPAN graduates will come out baseline with a DNP, which is becoming more common across the country. But if they want to go back to school, like Colonel Stone, Colonel Yeager, they can go back for their PhDs. A lot of the PhDs are in neuroscience and pharmacology, but there are other opportunities if they wish to apply. There's also MBA programs, MHA programs they can apply to. There's trauma courses, there's military working dog programs, there's fellowships, which Colonel Yeager also participated in one of those fellowships with DARPA, but there's also fellowships with the Joint Commission. There's advanced training opportunities with MIT, GW, Stanford, some of the top programs in the country. We do a lot of advanced regional anesthesia programs, advanced airway programs. We even have an acupuncture program we can do. More military related courses, like CBRNE, which is chemical, biological, radiological, nuclear programs, expert field medical badge, airborne, aerosol. So there's a plethora of opportunities. Again, that variety is really what keeps it interesting in the military. You're not locked into, going to University X in that area, practicing there, taking a job after that, working 15, 20 years at that facility, limited on your growth. And a lot of programs will offer you, 50, 75%, but these are full paid tuitions. Colonel Yeager, how long? I know you've done both, but your PhD program was what, 3-4 years?
It was a 4-year program, sir.
Yeah. 4 years to get a doctorate, to do something that you love doing, right? And be able to come out and do that bench work to help your brothers and sisters later on. I mean, the opportunities are tremendous, and it's hard to even fathom the opportunities that are available to you.
That's right, sir.
So mentorship within the Army is one of the intangible benefits that we are able to offer our providers and soldiers. I like to give each of you the opportunity, if you like, to leave our viewers with one of your tips or a piece of advice about becoming an Army CRNA.
So advice on becoming a CRNA, is that one of the part of the question?
Mm-hmm. Yes, ma'am.
So mine would be very proactive, work on being a good communicator, become a planner, be very flexible, and learn how to multitask, because those are skills that are going to be crucial to your success. And learning how to become resilient, manage your stress, and take care of yourself while you're also doing that education process and taking care of your family, because it's very important to be able to maintain your own health and mental wellness and well-being in order to be successful. So that's also a huge aspect of being successful in the program. So those are the things I think we should focus on and would also like to highlight.
Colonel Yeager, sorry, go ahead, Major Robinson.
Sorry, I would just say that from my experience training a lot of people in the phase 2 in the clinical program, that the best ICU nurses make the best CRNA students. And so I would encourage people to just really hone their ICU skills Take care of the sickest patients you can take care of. Take care of them in the most uncomfortable situations you can, whether that's transporting somebody down to MRI or transporting them across town in an ambulance or a helicopter, or just getting into those uncomfortable situations and take care of them if you can. That'll make you a better ICU nurse, and that'll make you a better SRNA. I would also say that if you're considering joining this program, I would say run, don't walk into the program. Just do it. You will never regret it. I've never met a CRNA who said, wow, I really regret this. I'd really like to go back to the ICU. That just doesn't happen. Every CRNA you meet just loves their job, and they don't regret it. And, so I would say go for it.
Lieutenant Colonel Yeager, sir, do you have any closing tips?
I do. So I think probably the biggest thing going in, if you're considering coming in here into the military, the first thing is we want you, absolutely. We want everyone to apply, and we'll take the best applicants, but it requires us to get those individuals to apply in, and we'd like to see your application here at USAGPAN. It's an eclectic environment. There's a focus on equal opportunity. There's a focus on making sure there's diversity in our community, and it's what's amazing of these individuals that come through our program is you see a lot of them are very resilient, right? So you start looking at individuals who have come from a very eclectic backgrounds. Case in point, I grew up in very humble beginnings, and here I am 21 years later, and the Army is the reason I'm here. And I'm very thankful for the opportunities that the Army has given me at this point, and it elevated me in my social status and elevated me to achieve these goals that were quite impossible when I was a child. So it's I'm very thankful, and it's a pretty amazing opportunity to be here to talk to you about these things. In addition to that, I do want to add that now is the time to act, like Major Robinson said, but the perspective that I want to have here is that you could always be a nurse anesthetist in a civilian setting. You could always go back, you can do OB, and you can drop epidurals in any community hospital in the United States, and they'll be welcome to bring you on. But you really only have one shot to be an Army CRNA, and that's when you first come in. Or either when you graduate from a civilian program, or if you go through USAGPAN. That's really the only opportunity. There's few exceptions of individuals who have had a civilian career and then moved into a military career later on. So this is going to be your one opportunity, and I highly recommend that you take advantage of it and definitely experience the adventure that each of us have all had.
And I'd like to thank you all again for being here with us today. But this brings us to our Register to Win event. As advertised, all participants that pre-registered for today's event have been entered into the Army swag bag drawing.
So we're going to go ahead and draw for the name right now. So
Let's see.
Milka Rosario.
Milka Rosario.
Milka
Congratulations.
Rosario.
Yay.
So we'll reach out to you after the episode. Perfect. Awesome. Well, on behalf of the 6th Army Medical Recruiting Brigade and Battalion, I'm Major Christine Lee, and with me I also have
Sergeant First Class Michelle Phillips from the Valencia Medical Recruiting Station.
Sergeant First Class Johnson from the Culver Army Medical Recruiting Station.
And I'm from the San Diego Medical Recruiting Station. And again, we just want to thank you all, our viewers, for tuning in and asking your questions. And also want to definitely thank the distinguished guests that we have today on our panel for sharing your experiences, your thoughts, your tips, and your time. So we appreciate and look forward to assisting you with your Army applications very soon. And our team will reach out to each one of you to contact you with a local Army medicine recruiter in your area. So again, don't wait. Just like they said, the time to act is now. So please do come and see us soon.
Awesome. Well, this wraps up another episode. Hope everybody has a happy, healthy, and safe weekend. And we look forward to seeing you again right here next time on Sick Call. Bye.